Okay, so what we are going to look at today is listening part C. Reading and listening test are quite identical, which means the kind of sections that you have, the kind of questions that you have, and the skills which are being tested under each section of reading and listening are quite similar. Okay, the major difference is that you are listening to the content and answering in the listening test, whereas in the reading you are reading an aspect of the text and then you are answering those questions based on it. Okay? So the listening part C, okay, comprises of a total of 2 presentations. Now this can be either a presentation or it could be interview, and you have a total of 12 questions. Majority of these questions are based on identifying the speaker's attitude or speaker's opinion. The other question types could be purpose, main idea, and very rarely you can have a detailed question where you are asked to listen for a specific detail. But attitude, opinion, and purpose forms the major part of listening part C, because as you all are familiar, main idea or just questions are more common with listening part B test. Okay, so part C is more about identifying speaker's viewpoint, and that is the reason why it becomes very important for you to be familiar with the kind of language that you have in the listening part C. The listening part A and B, the language used in both of those sections is comparatively easier because there you have a day-to-day conversations. So you have a nurse or a doctor talking to each other in part B, for example. In part A, you always have a healthcare professional interviewing the patient. So that's a routine language. But when it comes to part C, you have more of a language that is commonly seen in the podcast. Okay, so it's very important that you are familiar with the kind of language. And I've also shared previously a lot of websites that you can listen to when you are trying to get familiar with the language. So if I was you, or if I were preparing for the OET test, what I would do is get up in the morning, and while I'm walking in my garden or while I'm cooking for myself, I would be listening to those podcasts continuously, at least say 45 to 50 minutes, the minimum amount of listening that you do. It should be. Okay, depending on how familiar you are with the language. The less familiar you are, the more practice you need. So that is the concept of binge listening. You listen to the language as much as you can. So there are a lot of resources that I have shared with you previously as well, and I can also list them again. For example, you can listen to bbc.co.uk. Then if you go on to YouTube channel, you can listen to Dr. Norman Swan. Then if you want to get familiar with the Australian accent, what you can do is you can go to www.abc.au and then type health related. Like if you will open this page abc.au, you will find a lot of different topics. But if you go to the health related topics, health is a sub kind of portal there. So if you will go on to the health section, you will be able to find a lot of podcasts there, which could be really helpful to you in order to improve your familiarity with the kind of language that you get in the listening part C. That's very important, because in listening part C, you're not listening for one word, you're listening for a complete idea that is being presented by the presenter or by the interview. Okay. So give yourself as much exposure as you can. Now, the second step to improve your listening part C is to work on your pre-listening skills. How you are decoding the questions and how you are decoding the answer choices. It becomes very, very important for you to read both question as well as all the answer choices beforehand, before the audio starts. Okay, so that is the reason why you get more time in listening part C, because the answer choices, as you can see, are quite longer, right? And all these answer choices, or at least two of them, kind of they are summarizing the whole 1 minute conversation, and therefore they could be very, very complex. Okay, the answer choices are not very easy to understand. They are incredibly complex if you do not understand them fully. So that is the reason why it takes you a lot of time for listening part C to understand the question and understand the answer choice. So what we're going to do today is we're gonna, for first two questions, I'm going to explain you how you decode the question, and then I'm going to give you more practice tasks to, learn this skill yourself and practice it further. So what I'm doing basically in listening part C is I'm trying to kind of, predict the whole framework of the conversation. Most of the time, the framework tends to be very common. Like the first one section would be about why they, ventured into that particular area, why they decided to study something, why they decided to research on that area, why they decided to volunteer for that particular, epidemic. Then the second and third sections would be mainly about how was their experience when they did it, or what is their opinion about how patients felt about it, or how patients reacted to it. And then towards and they would talk about, the future implications, how it can be in future, how it can be improved, or what changes would they like to, happen to this system or this program, or what is the prospectus of this particular test in the future. So for majority of the presentations or interview, you will hear this is going to be the framework. However, it's very important that when you are reading the questions, you kind of try to get a tentative framework of that particular conversation, right? How do you get that is with the help of questions. The questions will give you the focus. The questions will tell you what is going to be the focus of that particular section of the audio. So here you can see the heading or the topic sentence, as we call them, or the context sentence, tells you that this is a presentation by a cardiologist. So this is giving you a very important clue, isn't it? It is a presentation. That means you know that there is just going to be one speaker. Okay, that is Dr. Tim. Who is he? He's a cardiologist. So you know that if he's a cardiologist, he is going to talk more about the cardiovascular system. Okay, and it says he's going to talk about rehabilitation after a heart attack. So that's another key area, or that's another key word that is helping you understand, or that is helping you predict the framework of this entire presentation. So he's talking about rehabilitation. Any idea what would be the purpose of rehabilitation after a heart attack? When you are reading the context sentence, this is another thing that you can do. You can use your background medical knowledge to kind of, get yourself more into the topic, to be more engaged with the conversation as it happens, rather than just going for keywords, or rather than just passively listening to it. Right? One of the reasons why we all have chosen to take OET is because it is familiar, it is relevant to your profession, and that means it helps you to easily engage. You find it interesting because you already know something about it, right? So yeah, one purpose of cardiac rehabilitation is preventing further heart attack, uh, but the main purpose of cardiac rehabilitation is to regain, yes, the cardiac output, increase the increase the capacity of the cardiac muscle which have been injured. So that is the basic purpose of cardiac rehabilitation, because you are trying to get the heart back to the normal functioning level. So say for example, if prior to the heart attack, if the patient's LVEF was 60%, it would have come down to 35-40% after a heart attack, depending on how severe the damage was to the myocardial muscle. So what we are going to do through cardiac rehabilitation is helping them increase their, exercise capacity, help them increase their ability to work for longer hours, and gradually the heart also adapts to the new levels of exertion, and that is the main purpose of cardiac rehabilitation. And ultimately, yes, it would also help to prevent further heart attacks because the patient is somehow exercising. Okay, so the other benefits that you would get would be definitely prevention of further heart attack as well if they continue with it for a longer period of time. Now, what we do after reading this is we go on to the question, we go on to each of the question, and we try and identify the focus of the each question, right? So different students prefer different ways though. Okay, some of the students prefer reading the question and answer choices both together. So that's one way you can do it. Another way is read all the questions first and then analyze the answers in detail, so that you first get an overview of the whole talk and then you get into more detail. So as you can see here, the first question says, Dr. Reston believes that patients recovering from heart attacks. So what is his belief about the patients who are recovering from heart attack? So in this part of the conversation, I can predict that he's going to talk mainly about the perception, okay? Patients' perception, particularly those patients who are recovering from a heart attack. Then if you look at the second question, it says, Dr. Reston is particularly surprised by how many patients. So how many patients? So that gives you an insight that probably he's going to give us some stats here, okay, which could be related to people taking up the rehabilitation program or people who successfully complete it. It could also include the people who get benefit out of it, okay, and something that surprises him. So again, here I have to identify his viewpoint, isn't it? What is his viewpoint towards the statistics that's giving? Then if you look at question number 3, okay, it says, Dr. Ruston says that the rehabilitation programs are very safe. That means here he is going to give out some reasons, okay, why he thinks these programs are very safe. Then question 4 says, why, what did Ruston's patient Lucy feel about joining a group rehabilitation program? That, as I told you earlier, this is how it is going to be structured. If there is a program or if there is a presentation or if there is a new form of treatment that they are discussing, they are definitely going to give out examples of how it worked on their own patients. Yeah. So here he's going to give us an example of a patient called Lucy, and he's going to discuss how she felt when she was asked to join a group rehabilitation program. So see that the concept is changing slightly here. Yes, this is more about the group rehabilitation program and not the one which you take one-to-one with your physiotherapist. Then again, Dr. Ruston believes that rehabilitation programs would be improved by, right, as we discussed earlier. They could be talking about how they can be improved, the future of rehabilitation program. And last one, why Dr. Ruston mentioned his patient called Michael. Why is he mentioning? Okay. So here we will again get to know one more clinical presentation or example of his own patient that he's going to give us, and then with that example he's going to explain us something. We have to find out what is he trying to explain us with the help of that example. So now, since I've got the overall framework of the whole presentation, I have 6 questions per presentation, so I've got the overall framework. Now I would analyze each question in detail. It's very important that you read all 3 answer choices before the listening starts, because once the listening starts, you can't pause the audio, you can't rewind it, you can't stop it, you can't play it again. So none of the options are available. Once it is gone, you can't really go back to the audio. You can though go back to answer choices, but then the next question is lined up, so you can't again really waste too much time on reading the answer choices once the audio has started. And that is what makes listening part C more challenging. So if you work well on your pre-listening skills, then your time management would be very well once the audio starts. So now I have read the question, okay, and it says Dr. Ruston believes. That means this is about his belief. The patients recovering from heart attacks, and if I read the answer choices, may fail to follow instructions. Instructions about what? Medication. So my keyword here is may fail to follow medications. Realize, that means they do acknowledge the fact that heart surgery provides only a temporary remedy. So they do acknowledge the fact that they haven't recovered, or they haven't kind of overcome the risk of further heart attacks, and underestimate, okay, miscalculate, underestimate how much their lifestyle affects their recovery. Which means if I try to simplify this, uh, A would mean that they have poor compliance to the medication. This is what I do. I try to simplify. If I don't write it, that's fine. But I would try to make a mental note of simplification. Second one says that they acknowledge the fact. So there's no simplification here for B as such. And for C, it means they don't uh, fully understand, right? The importance of lifestyle modification. They underestimate. They underestimate means they don't fully recognize the importance of lifestyle modification, because it says how much their lifestyle affects their recovery. So affect, definitely it is going to be the effect of lifestyle would be there on the recovery, but they don't really understand how much it could be. They don't understand the extent to which their lifestyle can affect them. So once you have analyzed the 3 answer choices, what you do is you kind of see the differences in it. Okay. So A is has more to do with medication, B has more to do with their perception, and C has more to do with their perception regarding lifestyle. So A medication, C lifestyle, and B actually is nothing about future, but it says that they have already had a surgery and now they do realize that it is a temporary remedy. Similarly, so this, as you can appreciate, is an opinion question, because you have to identify Dr. Reston's opinion regarding this patients. Okay? Or you can also consider this as an attitude questions. What is the attitude prevalent among patients recovering from heart attack? What is their general attitude? Do they all realize that this is a temporary remedy? Do they all fail to take medications, or do they all do not realize the importance of lifestyle? Second one, Dr. Ruston is particularly surprised. So my keyword here is surprised. Okay. What is he surprised about? So while giving out statistics, he would give all sorts of statistics. That is not my focus. My focus is the number or the fact that he is surprised about. So again, this is opinion question. Yes, as I discussed earlier, majority of the questions in listening part C will be opinion questions. So now, how many patients, okay, how many patients are unwilling to finish? That means they may be starting the rehabilitation program, but then they are not able to finish it, or they are not willing to finish the program. Ignore the statistical evidence about benefits of rehabilitation. Ignore. Ignore means I know it, but I still choose not to pay attention to, right? Ignore doesn't mean unaware. And feel discouraged. So the negative words really help me to pick up the focus of each answer choice. Okay, all three are negative. May feel, sorry, unwilling, ignore, discouraged. So that gives me, kind of an idea that he's surprised by the patient's negative attitude. But negative attitude about what? About not completing the rehabilitation program, or their ignorance towards the facts, or how they feel discouraged by the process of applying to join a rehabilitation program. So this is actually negative for rehabilitation program. A and B is negative for patient, from the patient's side, that everything is fine, but they are unwilling to join. Everything is fine, but they ignore the benefits. But C is more towards the negative of rehabilitation program itself, because it says the process of applying. So maybe the process of applying would be, so too difficult. If this is the correct answer, okay, then maybe the speaker would say that it is too difficult, or it is too lengthy, okay, procedure that people do not usually opt for such procedures. So this can be the alternatives that they can go for. Okay, so again, I have got both the questions decoded. We have decoded the answer choices as well. The next step that I'm going to do is I'm going to play the audio only for these two questions, right? And I would play the audio twice, so you get the opportunity to listen to those questions 2 times before you finalize your answer. And then while you are listening, I would suggest, when you are listening to attitude and opinion questions, do not get taken away by one word. Attitude and opinion questions are always summarizing. Yes, I don't say, for example, if I meet a stranger, would I finalize their attitude just based on one word that they have said? No, I would sit back and observe their behavior. I would sit back and observe their body language, their tone, the way they are speaking with others, and then I would kind of, build up, perception about their personality or their attitude or their opinion. So similarly here, you are not supposed to choose or finalize your answer based on one, because the tricky part here is that one word from each answer choices will be there. It would not be that easy for you to rule out one answer choice, because you will see that something about each answer choice is there in the. What you have to do is you have to find out which answer choice best summarizes his attitude. Okay, so just because you might have heard something about medication, you should not end up choosing A as the answer. Similarly, just because you heard something about exercise, you would not end up choosing lifestyle as the answer. The whole sentence, do not just pick up random keywords. No, the whole sentence should make sense. Okay? If he is saying that although they have been given with all the instructions, they poorly comply to the medication, and hence would be the correct answer. Okay, so I'm going to play the audio next.
Good morning. I'm Tim.
I'm sorry, I mistakenly closed.
Good morning. I'm Tim Rushton, and I'd like to talk to you about rehabilitation programs for patients who've had heart attacks and undergone surgery. A patient may, for example, have had stents inserted to widen their arteries, and this solves an immediate problem without guaranteeing their long-term health. The importance of taking the drugs that have been prescribed is undeniable, and non-compliance is seldom an issue. But the patient's ability to improve their prognosis through the choices they make is sometimes not fully appreciated. If a patient takes exercise and makes dietary changes, they're more likely to lose weight, reduce their blood pressure, and possibly control their level of cholesterol. The evidence available suggests that once someone's going beyond moderate exertion and can sustain such effort for a longer period, then the vascular system and muscles adapt and strengthen. Basically, the cardiovascular system starts to perform more efficiently. We actually have some pathological reversal, and that's an extraordinarily positive message to give patients. What I find shocking is that annually thousands of people are choosing not to do potentially life-saving cardiac rehabilitation therapy. Joining a rehabilitation program after a heart attack can cut an individual's risk of dying in the next year by as much as a fifth, and will significantly reduce the probability of having to be readmitted to hospital with a recurrence of heart problems. Many people opting out of rehabilitation seem to be well informed about these facts and figures, and yet research shows that even if a GP refers them and makes the process of signing up easy, patients may decline an offer made to them or drop out of the program quite soon. It seems that many patients are convinced it's dangerous for them to do too much exercise in a rehabilitation program in case it puts them back in hospital with a second heart attack. I regret to say
Okay, now I'm playing it for the second time. In case if you have missed it, listen to it carefully.
Good morning. I'm Tim Rushton, and I'd like to talk to you about rehabilitation programs for patients who've had heart attacks and undergone surgery. A patient may, for example, have had stents inserted to widen their arteries, and this solves an immediate problem without guaranteeing their long-term health. The importance of taking the drugs that have been prescribed is undeniable, and non-compliance is seldom an issue. But the patient's ability to improve their prognosis through the choices they make is sometimes not fully appreciated. If a patient takes exercise and makes dietary changes, they're more likely to lose weight, reduce their blood pressure, and possibly control their level of cholesterol. The evidence available suggests that once someone's going beyond moderate exertion and can sustain such effort for a longer period, then the vascular system and muscles adapt and strengthen. Basically, the cardiovascular system starts to perform more efficiently. We actually have some pathological reversal, and that's an extraordinarily positive message to give patients. What I find shocking is that annually thousands of people are choosing not to do potentially life-saving cardiac rehabilitation therapy. Joining a rehabilitation program after a heart attack can cut an individual's risk of dying in the next year by as much as a fifth, and will significantly reduce the probability of having to be readmitted to hospital with a recurrence of heart problems. Many people opting out of rehabilitation seem to be well informed about these facts and figures, and yet research shows that even if a GP refers them and makes the process of signing up easy, patients may decline an offer made to them or drop out of the program quite soon. It seems that many patients are convinced it's dangerous for them to do too much exercise in a
Right? Now, what I would do is I would get both the questions as well as transcript for you so that it helps you understand. Okay, right? So you were supposed to listen to patient's attitude here. What kind of attitude they have. Now, if you see here in the transcript, you can see he was first explaining. That is very usual, okay, where they would initially say who the program is for, and they would go on to give overview, and then they have said that this was there. A patient may, for example, have stents, and this may solve immediate problem without guarantee their long-term health. So here you do have this, which says surgery is a temporary remedy. But is it something that patients think? No. This part is mentioned as fact and not patient's attitude. Yes, it is fact that surgery offers only a temporary remedy. But that's not the fact. Similarly, about the medication, right? This is very, very common for listening part C to have something about each answer choice. So here they have said importance of taking drugs is undeniable. That means it's very important. You can't deny it. And non-compliance is seldom an issue, right? If they had said it is not an issue, it would have been very easy for you to rule out A as an option. But seldom. So seldom word also means rarely, right? And this is how negatives can come in listening part C, where negatives won't come straight away as no, but they would come with words like rarely, hardly, seldom, little, few. All these words have negative connotation. So be really, really careful about them. You would always have negatives like this. So here it says non-compliance is not an issue, right? But here it says they may fail to follow instructions. So this also is clearly contradicting what was given, okay, and therefore is wrong. So why is it wrong? Is because it is contradicting what is given in the talk. So C is the correct answer. Why? Because here you can see he said that in fact doing these exercises helps them, okay, that the patient's ability to improve their prognosis through choices they make. So the choices that they make, okay, they also described it by saying by taking exercises or by making dietary changes. So choices that they make are these lifestyle changes, okay? And they have said is sometimes not fully appreciated. Okay? To appreciate is to acknowledge, to recognize. So here also it is saying underestimate, not fully appreciate it. That means they know about it, but they don't really fully understand the importance of lifestyle changes on their recovery. So C is the correct answer here. Yes. Similarly, for second question, it now here see another challenge that you have with the presentation is you'll have to be careful about how the speaker is moving from one topic to another, okay? Because you do not have any pause here between two questions. So you have to be careful about how the speaker is changing the topic. So when he started giving out stats, you could realize that this is question number 2. Now, in question number 2, he first went on to say that thousands of people choose not to do cardiac rehabilitation therapy. Okay, so it's not that they do not complete it, but they don't do it. Even though now these facts were mentioned as a fact that joining it can actually reduce the risk, okay, as much as by fifth. So the risk can significantly reduce, but still many people decide not to do it. And it's not that they don't know it, because it says they are well informed about these facts and figures, and yet research shows that even if a GP makes the process easy for them, so that rules out option C, the process of applying to join, because the process, even if it is difficult, the GP is there to help them out to make it easy for them. Still, they decline an offer made to them or drop out of the program quite soon. So it's not that they pick it up first and then they give up, but they decide not to do it. And even if they do it, they later on give up. So some very useful words that you can learn from this is non-compliance. If you're not already familiar about that word, prognosis, I'm sure all of you would know this word. Then sheldom, as I discussed earlier. Okay. Then lifestyle modification, I'm sure all of you know the meaning of this word. Probability, the possibility. Um, then recurrence, okay, it's a repetitive episode of the same problem again. Well informed, okay, those who have the knowledge about the topic is well informed. To decline is to refuse the offer. So they know it, but they still decline, and therefore B is the correct answer here. They ignore the statistical evidence. It's true that they are unwilling, but not only to finish, they are unwilling to join, and they are then also, even if they join, they give it up before completing it. So A is incomplete. It's true that they are unwilling to finish, but that's not the summary of the whole extract. What is he surprised about is that even though we have so much of facts and figures that it can reduce the heart attack, it can reduce the risk of dying by 1/5, okay, but still people decline. Even if the GP is helping them to sign up, still they decline. So GP is helping them, that helps you to rule out option C, and therefore B is the correct answer here. This is what I was trying to explain when I said do not select answer just because you heard one word about it. Okay, for example, drop out. To drop out means to give it up in between. So just based on that word, you can't go with option A. You have to actually think about the summary of the whole 1 minute conversation. And in the beginning itself, he said, I find shocking. So shocking helped you to say that this is something where he's talking about, something that he's surprised about. And he clearly says how many people are choosing not to do potentially life-saving cardiac rehabilitation therapy. So it's not that they're not finishing, he's surprised about how many people are not willing to join the program. Okay, now we'll do the next two questions. Question number 3 and 4. So here it says that rehabilitation programs are very safe. Now we have to find out why. Okay? So in this part, your focus is reasons why he thinks rehabilitation programs are safe. So here it says the exercises done at a controlled and steady pace. So they are not kind of a very vigorous exercises. They are controlled and done at steady pace. They are designed for people who have experience of taking exercise. So this means they do not include novice people, right? Those who are new, and include detailed advice on any possible risks. Detailed advice. So why is it safe, or why Dr. Reston thinks they are safe? Is it because of the kind of exercises that are involved? Is it because of the type of people who are allowed to do these exercises? Or is it because of the instructions and advice that are given while doing these exercises? What is he trying to highlight when he's trying to say that the rehabilitation programs are safe? And for next question, he is going to give us example of his patient called Lucy, and we have to find out what she feels about group rehabilitation program. Now again, if we look at the negative words, embarrassed, worried, uncomfortable. So you get to know that at least she was not very happy about joining it, right? And that we have understood so far, most of the patients do not choose or do not opt for it. So here maybe he is going to give us reason why she was not willing to join it. So was she embarrassed about being in a minority in her class? Okay. So minority can be based on gender, it could be based on age, it could be based on race, it could be based on one's socio-economical background. So we'll have to actually figure out which kind of minority is he describing here. Then worried about being put under a lot of pressure, right? And uncomfortable about being in an environment that didn't suit her. So what was the problem? Was the environment a problem? Was the people who were doing with her a problem? Or the amount of stress or pressure that she felt was a problem for her when she had to join a group rehabilitation program? So now I would be playing this part of the conversation, and I would ask all of you to answer these questions. Okay? So for this question, when he starts talking about Lucy, okay, that is a trigger point for you to move to the next question.
Rehabilitation program in case it puts them back in hospital with a second heart attack. I regret to say patients are picking up mixed messages from the media. The benefits of exercise are certainly discussed, but there are also warnings about embarking on exercise programs, especially for those who have done little previously. The reality is that the chances of having a cardiac event during exercises done as part of a rehabilitation program are extremely slim. This is mainly a direct result of the exercises having a clear structure, with a warm-up stage beforehand and a gradual step-by-step cooling down period at the end. What about other reasons for people not doing rehabilitation therapy? Let's consider the case of one. I'll call her Lucy. The idea of exercising in what she assumed would be a gym, or a setting closely resembling one, made her feel uneasy. Lucy felt that, like many people, she wasn't exactly sporty, and so would feel out of place there. She expected the group to be largely male, and with good reason. Significantly more men than women have heart attacks, but this imbalance didn't bother her much. She thought the instructors would probably be fairly strict, which she felt she could cope with. However, Lucy still didn't show up for the first session. But when she overcame her dislike of being in a gym, she found it more enjoyable than she imagined, and stuck with it. Let's consider how rehabilitation programs could be.
So these are the ways in which the speaker would be giving you the hint when when he said what are other reasons when people decide not to do it. Similarly, here if you see for the next question, he said that let us consider how they can be improved. So the key would be there. There are two ways in which the presenter would give you a key. One way is they would just pause and start talking about the next topic, or second way is when they ask question to themselves, okay, um, to answer it. Now here it says they are very safe because I couldn't see any one of you sending your answers. So if you could send it, I can understand whether you are able to follow the strategy, whether you are able to choose answers. Okay, so I can see all of you going with A here for first question, and except Pankti, but yeah, A is the correct answer. Controlled and steady pace. I would show you the transcript to help you understand this. So if you can see here, he was explaining that people are picking up mixed messages. Okay. The reality is that the chances of having a cardiac event are extremely slim. See, this is again negative. This is again another way of giving negative. There are no chances, but they are extremely slim, means very rarely it could occur. This is mainly a direct result of exercising having a clear structure and step-by-step cooling down and warm-up part. Okay. So clear structure and therefore controlled and steady pace. Now B, or there was something about B as well, but if you see that was mentioned as a fact, they have mentioned here that the benefits of exercises are certainly discussed, but there are also warnings about embarking on exercise programs, especially for those who have done little previously. But they are warnings, okay? And the warnings he has already mentioned earlier that the people are picking up mixed messages. So in fact, there are benefits that are highlighted, but on the other side, some media outlets or somebody out there in the public domain is claiming that it could be dangerous to take exercise program, particularly if they have never done it before. But question is asking us entirely different thing. It is asking why they are safe. So it doesn't say that it is only for those people who have done exercises previously, right? So it is not his opinion. See how you can differentiate. Here it says, I regret to say patients are picking up mixed messages from the media. Now, what are those mixed messages? The benefits of exercise are certainly discussed where in the media, but there are also warnings about embarking on exercise programs, especially for those who have done little previously. So this portion is about how media is portraying rehabilitation programs. Question is asking you to find out what is Dr. Rustin's belief, why he thinks they are very safe. So here he says the reality is that the chances of having a cardiac event, that is his opinion. So when he said that they are only designed for those people who have taken previous exercises, that was not his opinion. Okay, that was how media is portraying it. So keeping focus on the question could be helpful. Okay, now for second one, some of you have decided A and B. But both A and B are wrong answers because they both were ruled out. Okay, let me again show you the transcript. Let's see if you can see the transcript here. So here it says that the idea of exercising what she assumed would be a gym. Okay, the idea of exercising what she assumed was a gym or a setting closely resembling one made her feel uneasy. So what was she uneasy about? Being in a gym. She felt that she would be a minority, largely male would be there. Okay, but then she said that, but this imbalance didn't bother her much. So here, answer option A was ruled out. It is true that she thought that there would be more males there, but she was not bothered about it. She was not embarrassed about it. This imbalance didn't bother her much. She expected, okay, the group to be largely male, okay, and it was true, her expectation, but she was not embarrassed about it. So minority in her class is correct. But if you consider the full word, full phrase, embarrassed about being in, she wasn't embarrassed because it says, but this imbalance didn't bother her much. Then she thought instructors would probably be fairly strict, which she felt she could cope with. So she was not also worried about the stress. She felt it. She thought that the instructors would be strict, but she wasn't put off by because of that reason. She felt she could cope with it, right? So this worried about also is ruled out. C is the correct answer here. Uncomfortable, because again they have mentioned this fact here that she didn't still show up for the first session, but when she overcame her dislike of being in a gym, she found it more enjoyable. So the setting was the main issue for her. Okay, now this is the reason how you can rule out A and B both. So part C is always about engaging fully in the conversation, understanding it fully, because if you understand it fully, only then you can summarize it. If you would choose answer or options based on just one word that you might have heard, you may 80% of the time end up choosing wrong answer, right? So you need a proper practice for this. Now for next two questions, I want you to identify the question yourself, and then I would help you understand the question. Try to write keywords for yourself on a piece of paper. Then I'm going to decode the question for you. So again, this is opinion question, because it says Dr. Reston believes that, okay, and the focus here is in future how they can be improved. All three options are comparative, obviously, because he's talking about current rehabilitation programs and future. So obviously he's comparing what changes can be done to the existing ones. Okay. So do we need more input from patients, or do we need more variety in terms of content and delivery, or do we need more financial support? Then this is typically a purpose question, where we don't have to identify his attitude or opinion towards it. It is saying, why is he mentioning this patient? Which point is he trying to prove? So what typically happens in purpose questions is that, one thing you can do to identify the answers of purpose questions is to pay attention to the opening statement. For example, if I wanted to explain you the importance of performing, or the importance of, say for example, giving a back care to the patient, okay, so what I would do is I would say it's very very important for prevention of bed sores. And then I would go on to give you examples of how over the past 6 months, this many patients developed bed sores, and then it was came to attention that these patients did not receive back care properly. And then again, I would conclude by saying that if they had received proper back care, they would have, they wouldn't have developed this. So this is how purpose questions are typically designed. The writer tries to emphasize an idea with an example. So instead of getting taken away by what he mentions about those examples, you have to pick up the overview. What point is he trying to make through those examples? So here it says, warn that patients exaggerate their feelings. Is he trying to say how patients exaggerate their feelings? Okay, whether he's trying to prove that they require more careful observation, or is he trying to emphasize the need for psychological support? Okay, so now I'm playing this audio. Listen to it very, very carefully. And type in your answers as you finalize them.
Better in the future. Firstly, most programs are based on group-based exercises, and this may not appeal to everyone. There's also evidence that individuals from areas of greater social deprivation are less likely to participate. It seems to me that health professionals can't always blame the patients for not taking up offers. Sometimes what's available has little appeal. Consideration should be given to running programs based more on what individuals can do in the privacy of their homes. Greater resources could also be put into setting up online programs. In general, more can be done in tailoring programs to suit a wider range of individuals. Finally, I'd like to tell you about one of my own patients. Let's call him Michael, who was diagnosed with coronary artery disease at the age of 52. After surgery, he totally lacked confidence. Every little ache and pain he experienced made him think that there was a new problem with his heart, and this held him back from resuming normal physical activity, let alone taking on a rehabilitation program. He was booked on a cardiac rehabilitation program involving 8 weeks of closely monitored exercise, but equally importantly, he had sessions with a clinical psychologist to help manage the anxiety he was feeling. Now, he claims to be in a better place emotionally than he was before his heart attack. Rehabilitation isn't just about building up physical strength and fitness. There are other dimensions.
Does anyone want me to play this again? The last part? The last two questions? Okay, I can see answers coming in. Does anyone of you want me to play it again? Okay, if not, then let me know what answers have you selected. Okay, so now I can see all of you are able to apply the strategies that you have learned. That's very rare. All of you could get both the answers correct. Excellent. Yes, so it is true. Yes, he was explaining that most of the programs are group programs, but it won't appeal to everyone. So we need, more variety. We need online programs. We need individual programs. And the key, sentences that he used were more can be done to tailor the programs. So when you tailor it, what you do basically is you are trying to design it as per the individual's need, right? So what is available has little appeal. So so far it seemed as if people were not willing to take the rehabilitation program. Now he's trying to show us the other side of it, that it's not always the patient who are to blame, but we can also make some changes to it. So we can devise programs that can be done in the privacy of their homes. We can have online programs. So we basically need to tailor programs to suit a wider range of individuals. So that is more variety in terms of content and delivery. And then here he's trying to explain how in the beginning, yeah, so we have something similar to option A here, that he was actually trying to exaggerate. Yeah? It says that every little ache and pain he experienced made him think that he was getting a new attack or new problem, and therefore he was not willing to resume his normal activity. And then when he was provided with counseling to manage his anxiety, then he started feeling better. And the final clue in the jigsaw puzzle is here, that we need more than the physical exercises. There are other dimensions. So he was trying to highlight the psychological aspect of it, and therefore C is the correct answer here. Right? So this is an ideal test to learn the strategies, because you have one detailed question here, very safe, because not a typically detailed question, but yeah, a combination of why Dr. Rustin thinks they are safe. And then you had 2 or 3 opinion questions, okay, and you had one purpose question as well. So do you all have the strategies now clear for listening part C? Okay, now for the second half, what I'm going to do is I'm going to make all of you uh, read these questions, okay, and answer these questions in a given time frame, and then I'm going to ask each one of you to describe your answer choices. That would be a concept check for me. It would help me understand if you could get the questions correct, if you could follow the strategy. So just make a note of this context sentence. It is a gastroenterologist, Dr. Veronica. Again, this is a presentation about irritable bowel syndrome and its treatment. Yeah. So this is for a specific disease condition, irritable bowel syndrome, which and the speaker is going to describe the treatment for it. So let us very quickly underline the keywords. Then we will do all 6 questions at a stretch, and then I would ask all of you to explain your answer choices. What general point? This is a typical question prompt of main idea. What point someone is trying to make, okay, is main idea question. Now again, this is introduction. That means they are going to give you some information about IBS. You have to find out what is her main point. Okay, so here it says now so widespread that it needs more attention. That means it is becoming more common now. There must be a comparison from the previous times. Okay, for example, if I talk about stress, okay, so stress is becoming more common now, and therefore we need more strategies to address it. So similarly, if they tell about IBS, then A is the correct answer. Then it may be connected to stressful lifestyle, and it usually, okay, this kind of words are very important in the answer choices. When I say usually, it means at least 65% of the times. Okay, if I say mostly, it means more than 80% of the time. When I say almost every time, it's more than 95%. Usually is in the most cases, generally. So 65% of the time it responds well. This answer prompt has 2 parts. Can you see this? But then there is a recurrence. Then emphasizes. Today, IBS patients, what is she trying to emphasize? The patients can be more confident about diagnosis. So here we can go get to know that in this part of the conversation is good. So she's going to talk more about the diagnosis and the tests. Okay. So more confident that diagnosis is correct. They have choice. And choice means you have 6 options to choose from, and more aware of symptoms of similar illnesses, not IBS. Okay, that is why I, always try to point out that you can't just go by one word. You can't just go by aware of or aware of symptoms, but aware of symptoms of not IBS but of other illnesses. So all 3 options have a comparison in some way or the other. More confident, more aware. And B says choice of a range of diagnostic methods, and here it says today. Okay, so here also in B also there is hidden comparison, means in the past maybe they did not have the choice, but now they have. This is a sentence completion task as well. You see this first one is a question answer, whereas second is a sentence completion task. Then the treatment, okay, This is also main idea question. What does the treatment involve? Following a diet that permanently excludes. Whenever you are looking at answer choices, be always sure that you are highlighting negative words, extreme words, and blanket words. So negatives, permanently exclude is extreme, that they can never ever take. Similarly, making an effort to find substitutes for artificial additives and eating certain food again after a period of avoiding them. Can you see A and C are quite similar? A says permanently exclude. C says no, they don't need to permanently exclude. They can avoid it for a certain period of time and then they can take it again. Okay. And B is particularly about artificial additives. Then here you have a presentation about a patient called Matt, and you have to find out he was skeptical about. Any idea what does the word skeptical mean? Skeptical, doubtful. Okay, doubtful. What was he doubtful about? Again, I would pay attention to negative words, effectiveness of unconventional. What does unconventional mean? Any idea? The word unconventional, what does it mean? Conventional, routine, regular, traditional is conventional. Unconventional, new, modern. Okay. So he doubted the effectiveness of new ways. Then large number of apparently easy solutions. Apparently means seemingly. Okay. Seemingly. They may seem very easy, but they actually may not be. Seemingly. And the idea that condition could be cured by lifestyle changes alone. See, alone here is also extreme word. Okay, or you can also call it blanket word. It can be cured by lifestyle changes. That is a different thing. And it can be cured by lifestyle changes alone, which means you don't need any other form of treatment. You can cure it only by following lifestyle modification. So this is another very important trick that you can use. It's not a trick basically, it's something that helps you understand the answer choice fully without being taken away by one word. Okay, so this is Matt's attitude. Then here it is Sophie's feeling about the treatment. She was so worried that she became more unwell. Then she was willing to only follow part of the guidance. See, only is a blanket word here. That means she was willing to follow the guidelines, but not the full guidelines, only a certain aspect of it. And she was convinced that one type of food was causing her problems. So worried is negative, and so worried that because of that her condition deteriorated. 2 is also negative, that she was not willing to follow the diet fully, only one part. And 3 is she was 3 is more about the reason, whereas A and B are more about the treatment. And finally, IBS patients often wrongly believe that. So this is opinion question. IBS patients' opinion. But what do they wrongly believe? So we have to find out their belief, but not just that. Which belief is wrong? Okay. So the first, what the doctor would be doing here is she would be first giving what do they believe, and then she would say that this belief is not correct. Okay, or this belief is mistaken. Okay, so treatment may result in complications. Is it something that they believe? Diet doesn't have to be adhered to strictly, and it indicates an underlying organic weakness. Okay, so two conditions must be met here. One is that it should not be a fact, it should be belief of people. Two, those beliefs should be wrong. The doctor must kind of deny what they are believing. Only then this C would be the correct. B would be then, oh no, I'm sorry, any of A, B, or C, any of them would only be the correct answers when the belief that they have is not supported by this particular speaker. Okay, now let us very quickly decide how would we move from one question to another. So here she's going to give general overview. When she starts talking about test, then you would come to this question. Then if she starts talking about treatment, you would come to this question. When she starts talking about her patient called Matt, you would come to this question. Then patient called Sophie, then this question. And when she starts talking generally about all the patients with IBS, then you would come to this question. Okay, now I'm going to play the audio and I would play all 6 questions at a stretch without any pause.
Good morning. My name's Veronica Schulman and I'm a gastroenterologist. I'd like to talk to you today about irritable bowel syndrome, or IBS. As many as 1 in 5 of the UK adult population are affected by IBS to some degree, and it's been the focus of much research in recent years. It's typical for those suffering from the condition to report frequent diarrhea or constipation, or a mixture of both. They also experience abdominal bloating and pain. I'm always surprised more people don't suffer from IBS because many of us lead such chaotic, highly pressured lives and are often unable to maintain regular eating habits, which seems to aggravate the condition. It's difficult to treat, with no single medicine consistently and reliably resolving the symptoms in all cases. To add to the problem, a small number of people have what's called refractory IBS. That's IBS that hasn't responded to the normal first-line treatments. Unlike today, in the past, IBS symptoms were easily confused with other conditions, and the difficulty in making a definite diagnosis increased the uncertainty and therefore the suffering of many patients. So what about making an accurate diagnosis of the condition nowadays? Well, there's a stool test which rules out infection, while an endoscopy will eliminate the possibility of inflammatory diseases such as Crohn's disease and ulcerative colitis, which share some symptoms with IBS. A comprehensive history and special laboratory tests will in most cases prove that someone has IBS. The result is that the GP and the patient can trust in the accuracy of the diagnosis, and less time is wasted before starting an appropriate treatment. So next, I'll talk a little about how I like to treat my own IBS patients. It's been known for some time that diet is crucial, but opinions have varied considerably on which foods trigger the condition. I've become particularly interested in a group of starches and sugars, which many patients struggle to digest, and which are clearly linked to IBS symptoms. These starches and sugars are present in some grains, vegetables, and dairy products. Interestingly, they are also contained within one group of artificial sweeteners added to some food, and occur naturally in certain fruits. I start my treatment of an IBS patient by putting them on a strict diet for up to 6 weeks. During this time, all foods with the starches and sugars we've identified as problematic are excluded. And then slowly they are reintroduced one at a time to see if there's an adverse reaction. Common problem foods include wheat, onion, garlic, and broccoli. Up to 75% of patients improve to some degree when they're in the initial exclusion stage. Sugars and starches are found in so many different foods, and it's unlikely that patients will be sensitive to all of them. In fact, it may only be 2 or 3. So, how do patients react to this approach? I'll tell you about a patient called Matt, who lived in fear of stomach pain. He'd almost become frightened to eat anything. He'd endured it for several years and had seen many doctors, and even been willing to experiment with alternative medicine. But none of the treatments had provided much relief. Like many IBS sufferers I meet, he was overwhelmed by the amount of information about nutrition that was available. But he had serious doubts about the very many claims made by companies promoting particular diets as miracle cures. Matt still believed his condition could at least be controlled and desperately wanted to try something that had solid research behind it. He was impressed by the steady and structured methods I rely on. Before seeing me, another patient I'll call Sophie had been told to cut out dairy produce from her diet, but she found it hard to sustain and her symptoms continued, although they were intermittent. By the time she was referred to me, Sophie had become confused about whether dairy was really causing her problems. Her IBS was getting worse because she was so anxious. When she followed my method, she was able to discover precisely which foods were triggering her symptoms, which in her case included beetroot, apples and oranges, all of which she particularly liked, and so was initially reluctant to give up. However, she knew there was no real alternative, and she's now made more or less a full recovery. Patients with IBS are often deeply concerned about the basic health of their bowel and can mistakenly think that it isn't normal in some way. I often have to reassure them that their bowel is just very sensitive and that it won't suffer any long-term damage. If a patient usually follows a diet which controls their symptoms, and one day they indulge themselves by eating something they shouldn't and get some symptoms, that's not going to do much harm. The diet can be resumed and the symptoms will resolve themselves.
Okay, so for this particular video, you will see a post-listening video on Teachable, where you would see my explanation on each of the answer choices.